Thrush is a very common vaginal infection. Many women will experience it at least once. You might hear it called vaginal candidiasis, or perhaps a yeast infection. These terms all refer to the same condition. It is not a sexually transmitted infection, or STI, though sometimes sexual activity can trigger it. Understanding what thrush is the first step. This knowledge helps you manage it effectively. The main cause of thrush is a yeast. This yeast is a type of fungus. Its scientific name is Candida albicans. This specific yeast is responsible for most cases of thrush. Candida is a microorganism. It naturally lives in various parts of your body, including your vagina. Usually, Candida exists in small, harmless amounts. Problems arise when this Candida yeast starts to multiply. It grows more than it should. This overgrowth disrupts the natural balance in your vagina. This is when the symptoms of thrush appear. It's not about a new germ invading your body. It's about an existing resident getting out of hand. Many factors can lead to this overgrowth. So thrush is essentially an overgrowth of Candida yeast. It's a common issue, and importantly, it is usually very treatable. Think of your vagina as a complex garden. It has its own carefully balanced ecosystem. This ecosystem is teeming with various microorganisms. Most of these are beneficial bacteria. The dominant good bacteria are often from the Lactobacillus family. These Lactobacillus species play a crucial role. They help maintain a healthy vaginal environment. They produce lactic acid. This lactic acid keeps the vaginal pH low, meaning acidic. This acidity is important. It creates conditions that are unfavorable for many harmful bacteria. It also helps keep the Candida yeast in check. Lactobacillus bacteria essentially act as gatekeepers. They prevent an overgrowth of potentially problematic organisms. When your lactobacillus population is strong and thriving, your vaginal garden flourishes. It remains healthy and balanced. This balance is key to preventing infections like thrush. However, this delicate balance can be easily disrupted. Various factors can alter the vaginal environment. They can reduce the numbers of protective lactobacillus, or they can change the vaginal pH. When this happens, Candida yeast can find an opportunity. It takes advantage of the weakened defenses. It begins to multiply more rapidly than usual. Several common factors can trigger an episode of thrush. One of the most well-known culprits is antibiotics. Antibiotics are powerful medicines. They are designed to kill harmful bacteria causing infections. However, broad-spectrum antibiotics don't just target the bad bacteria. They can also wipe out the beneficial lactobacillus bacteria in your vagina. This reduction in good bacteria creates an opening. Candida yeast, which isn't affected by antibiotics, can then overgrow. Hormonal changes also play a significant role. Fluctuations in estrogen levels can influence the vaginal environment. This can make it more susceptible to Candida overgrowth. For example, thrush can be more common during pregnancy. Higher estrogen levels during pregnancy can promote yeast growth. Similarly, some women notice thrush around their menstrual cycle. Using hormonal contraceptives like certain birth control pills may also increase risk for some. A weakened immune system is another important trigger. Your immune system normally helps keep Candida under control. If your immune system is suppressed, it's less effective at this job. Uncontrolled diabetes is also a significant risk factor. High blood sugar levels can affect your entire body. Beyond medical triggers, some everyday habits can increase your thrush risk. Douching is a major one to avoid. Your vagina is self-cleaning. It does not need internal washing with commercial douches. Douching flushes out the good lactobacillus bacteria. It disrupts the natural pH balance of your vagina. This makes it easier for Candida to overgrow. Similarly, using harsh soaps or perfumed washes inside or around your vulva can cause irritation. This can also upset the delicate balance. Plain, unperfumed soap and water externally is all you need. The types of products you use during your period matter too. Scented tampons and pads can be problematic. The chemicals and perfumes in these products can irritate the sensitive vulvar skin. This irritation can sometimes disturb the vaginal environment. Your clothing choices can also play a part. Candida thrives in warm, moist environments. Tight-fitting clothing, especially underwear made from synthetic fabrics, can trap heat and moisture. Fabrics like nylon or lycra don't allow your skin to breathe properly. Opt for loose-fitting clothes when you can. Choose underwear made from breathable fabrics like cotton. This helps to keep the area dry and cool. Recognizing the symptoms of thrush is important. This allows you to seek appropriate advice or treatment promptly. The most common symptom is itching. This itching can affect the vulva, which is the external area. It can also affect the inside of your vagina. The intensity of the itch can vary. It might be mild, or it can be very intense and distressing. You might also experience a burning sensation or general irritation in the genital area. Another key sign of thrush is a change in your vaginal discharge. For many women, thrush causes a thick, white discharge. It is often described as looking like cottage cheese. However, not everyone with thrush will have this exact type of discharge. Sometimes the discharge might be watery, or you might not notice much of a change at all. Usually, thrush discharge does not have a strong, unpleasant smell. If there is a smell, it might be slightly yeasty, like bread. Redness and swelling of the vulva are also common symptoms. The skin around your vaginal opening can look inflamed. It might feel sore to the touch. Pain or discomfort during certain activities can also signal thrush. You might experience a burning sensation when you urinate. Sexual intercourse can also become painful. Preventing thrush often comes down to simple lifestyle adjustments. These adjustments help maintain a healthy vaginal environment. Good hygiene practices are fundamental. However, this does not mean aggressive cleaning. Wash your vulva gently once a day. Use plain, unperfumed soap and water, or just water is often sufficient. Avoid washing inside your vagina. It cleans itself. Always wipe from front to back after using the toilet. This prevents bacteria from the anus spreading to the vagina. Your choice of underwear can make a significant difference. Opt for underwear made from breathable fabrics. Cotton is an excellent choice. It allows air to circulate. This helps to keep the genital area dry. Avoid tight-fitting underwear and trousers, especially those made from synthetic materials. These can trap heat and moisture. This creates the warm, damp conditions that Candida yeast loves. Consider going without underwear at night if you are comfortable. This allows the area to breathe. Be mindful of potential irritants. Avoid using scented products in the genital area. This includes perfume soaps, bubble baths, and vaginal deodorants or sprays. These products can contain chemicals that irritate the sensitive vulvar skin. The connection between diet and thrush is a topic of much discussion. Many women wonder if what they eat can cause or prevent yeast infections. You may have heard that cutting out sugar can help. The theory is that yeast, including Candida, feeds on sugar. So, reducing sugar intake might limit its growth. While Candida does use sugar, the evidence that dietary sugar significantly impacts vaginal yeast levels is not very strong for most healthy women. Drastic sugar restriction is often difficult to maintain. It's not usually necessary for thrush prevention unless you have a condition like uncontrolled diabetes. Some people advocate for specific anti-Candida diets. These diets often involve eliminating sugar, refined carbohydrates, and sometimes yeast-containing foods. However, robust scientific evidence supporting these restrictive diets for preventing or treating vaginal thrush is lacking. What about probiotics? Probiotics are live microorganisms, often bacteria like lactobacillus. The idea is that consuming probiotics might help boost the good bacteria in your vagina. This could potentially help prevent Candida overgrowth. Instead of focusing on restrictive diets, aim for a balanced and nutritious eating plan. If you suspect you have thrush, effective treatments are available. Many of these can be purchased over the counter from a pharmacy. These treatments are usually antifungal medications. They work by killing the Candida yeast or stopping its growth. Common over-the-counter options include creams, pessaries, or a combination of both. Pessaries are small tablets or capsules that you insert into your vagina. Creams can be used internally with an applicator or externally on the vulva to relieve itching and soreness. The active ingredients in these over-the-counter products are typically azole antifungals. Examples include clotrimazole, miconazole, or fluconazole, though fluconazole is sometimes prescription only depending on the country and dosage. These treatments come in various strengths and course lengths. You might find single-dose options or treatments that last for 3 to 7 days. It is crucial to follow the instructions on the package carefully. Complete the full course of treatment, even if your symptoms start to improve quickly. Sometimes, over-the-counter treatments may not be sufficient, or your doctor might recommend a prescription medication. This could be a stronger antifungal cream or pessary, or it might be an oral antifungal pill, such as a higher dose of fluconazole. Oral medication can be a convenient option, especially if using creams or pessaries is difficult for you. Most women find relief from thrush symptoms within a few days of starting treatment. If your symptoms do not improve after completing a course of treatment, you should see your doctor. While thrush is common and often easily treated, there are times when you should definitely see your doctor. If you are experiencing symptoms of thrush for the very first time, it is wise to get a diagnosis confirmed by a healthcare professional. Other conditions can sometimes mimic thrush symptoms. A proper diagnosis ensures you receive the correct treatment. Don't just assume it's thrush and self-treat without confirmation, especially the first time. You should also consult your doctor if over-the-counter treatments are not working. If you have completed a full course of antifungal medication and your symptoms persist or worsen, medical advice is needed. It is possible you have a different type of infection, or you might have a strain of candida that is resistant to standard treatments. Your doctor can perform tests, such as a vaginal swab, to identify the cause. Recurrent thrush also warrants a visit to your doctor. Recurrent thrush is usually defined as having 4 or more diagnosed episodes within a 12-month period. If this is happening to you, there might be an underlying reason. Your doctor can investigate potential contributing factors.